So what question is here? They said the nurse is assessing a client peripheral pulses. Examination of the peripheral pulses. The nurse palpate the top portion of client foot, right? Palpate the top portion. The right pulse is easily palpable. Right one, easily palpable. The left pulse diminishes but still palpable. If you read this question, you got some information like the RN or LPN during the examine, they examine left and right both sides. Why? Just for compare and contrast left side with right side, right? So right pulse easily palpable, left pulse is diminished but still palpable. How should the nurse keep documentation these findings? So number one, bilateral dorsalis pedis, because the four option mentioning same artery, dorsalis pedis. So here the picture we can see the total arterial system in the body is called peripheral arterial pulses. The in our scalp, the artery we can feel is called temporal. In the facial, it is called facial artery. In the next side, carotid. But keep in mind, when you examine the carotid artery, don't push both sides in the same time, one by one. If you examine the carotid right side, after few minutes, left side. Do not do in the same time. If you push your thumb over here and hover over here same time, blood supply will be stopped in the brain. So carotid, then here it is called brachial in cubital fossa and radial artery, which is the most common. During the measurement of blood pressure, we put the stethoscope, I mean the diaphragm of stethoscope is in that artery, brachial. And when we count down the pulses in the wrist, we check the radial arteries. And this area is called femoral. Femoral. So radial artery we also use for fistula or graph, brachial artery as well, sometimes femoral or subclavian. So what about the lower extremity? In popliteal fossa, it is called popliteal arteries, and this bones is called malleolus, middle malleolus. Behind of the middle malleolus is called posterior tibial, and anterior side front is dorsalis pedis. If your patient have any peripheral arterial disease, that times the peripheral pulses will be absent or diminished, or like Barger disease, Raynaud phenomenon, you will not get it, right? So in this question, say the nurse check the right side dorsalis pedis, it is palpable, normal, but left side it is weaker and also it is palpable but weaker. How we could wrote it? So there are four options. Which one is the way to write? Bilateral dorsalis pedis pulses, palpable. Right side 2+, 2 plus, right? Why 2 plus? Because right side pulse is easily palpable. So 0 means absence, 1 plus 1 means weak, plus 2 means normal, palpable. So right side 2 plus. Left pulse is diminished, but still there. So it's not a 0. It is 1 plus. So 1 plus would indicate the thready, weak pulse that is difficult to palpate. And 2 plus here would be the pulse that required the light palpation, but once you locate it, would be stronger than 1 plus. So bilateral dorsal-pedis pulse, right 3 plus, left 2 plus. I said 2 plus is a normal, but left side is not a normal, it is diminished, so it is not an answer. Bilateral popliteal pulse, right foot greater than left. It is not a medical language to write right side is greater than left foot. Bilateral posterior tibial pulse palpable, posterior tibial, but this is not a posterior tibial, right? The nurse is palpate the top portion of the client foot, right? Top portion, they said. So it is not a question about the posterior tibial. So this is our choice is number 2. So what are the other explanation? Let me read it with you. So dorsalis pedis pulse located on the top or dorsal part of the foot. The nurse should compare the characteristics of arteries on the right and left extremity simultaneously. So if you check right side, in the same time you should check left side, except carotid. You have to put some time interval between compare and contrast the carotid. So 0 indicate absence, 1 plus indicate weak, 2 plus indicate normal, 3 plus increase full and bounding pulse, right? 2 plus is normal pulse. What are the educational objectives? What we learn from here? The nurse should palpate and compare the characteristics and equality of the pulse on right and left extremity simultaneously to determine symmetry or asymmetry. The force of pulse should be rated as 0 stand for absence, 1 plus stand for weak, thready pulse, difficult to palpate, 2 plus indicate normal and stronger than 1 plus, and 3 plus indicate consider it is 3 plus also consider the normal, but they are stronger, bounding, also easily palpate, and 4 plus also easily palpate, strong, bounding pulse. So if anything abnormal means left side is absent or 1 plus, it could indicate a pathological condition, maybe or such as any heart problem like aortic regurgitation or peripheral vascular disease. So this question asks about the cultural awareness. And when you work in the hospital, you get opportunities to explore yourself with different culture and religion, right? So the question is here, the nurse is teaching a client of American Indian heritage how to self-admin insulin. So Indian American heritage, right? So when we interact with the patient, definitely we could know what they prefer. Like, so as the nurse description, necessary steps, how to injection process, the client continuously avoid eye contact, occasionally turn away from the nurse, which action is most appropriate for the nurse to take this situation. So as I told you, so one of the most common cultural issue is eye contact. Some community allow eye to eye contact, some culture or tradition do not allow it. Hmm? But most important question arise for the nurses involve the faith and religious belief. It is also important. It is also part of the culture because certain religious group might refuse the some prescription medication. If you do not know, it would be difficult for you to continue. Some religious group refuse blood transfusion, some kind of surgeries, okay, or other potentially life-saving treatment because of their religious belief. So as a healthcare provider, we could know this. So basically, the Indian American, they like to give a value of silent, and also they prefer not not keep eye to eye contact, or they prefer warm or considered good for willingness. So now question is here, you teaching your patient how to use the insulin. The patient is not keep eye to eye contact, what you should do. There are four options. Continue teaching and verify understanding by written demonstration. Discuss how important it is for the client to pay attention. You and your patient both are adult. It is not the time. Tell them how to get attention or pay attention. Definitely, it does not make sense. Maintain eye contact during the teaching by following the client movement. How it is possible? So if patient turn the left, you turn to left side, right? It is not possible. Provide a written instruction and private place for the client to learn independently. But you are very smart. You know that the American Indian heritage, they do not prefer eye to eye contact because eye to eye contact indicate in their community it is a rudeness. But in American or European culture, eye to eye contact indicate the sign of attention or keep the trust. There are other options. We can choose one because after the procedure explained, you return it by demonstration. So remodeling. So what I do, can you show me it, please? So this is definitely the best option. One, you know the American Indian cultural system and also written demonstration. This is the best one. So you choose one. So about the culture, I'm going to read it for you. Communication with individuals of various culture may be difficult for the nurse at the time due to the cultural language difference. Verbal and non-verbal communication style, including the use of silence. So when you keep silence, it indicates you are willing to listen something. And during you keep silent, your patient organize their thinking to verbalize themselves. So keep silent is a non-verbal communication. So the mainstream American and European culture, direct eye contact indicate the sign of attention and trustfulness. People of American Indian or Asian culture view direct eye contact as a rude or disrespectful. We likely to move the eye away, not allowing the nurse to maintain the eye contact. If the client avoid eye contact during the teaching episode, the most appropriate action is to be continued. And finally, we return back by demonstration, remodeling. What are the education objectives? Individuals of American Indian and Asian culture, direct eye contact is a sign of rudeness and disrespectful, right? So the nurse demonstrate culturally competent care by respect and accepting their cultural communication pattern. So we should know about this. Question here, the nurse assessing a client during the dwell time of a peritoneal dialysis cycle. Which assessment would require immediate intervention? So peritoneal dialysis or hemodialysis. Peritoneal dialysis we do if the patient has a end-stage renal disease or chronic kidney disease, right? So during the peritoneal dialysis, we could check the patient any complication, especially the lungs, right? So peritoneal dialysis, there are some risks basically. The major risks of the peritoneal dialysis is a peritonitis develop. Peritonitis, I said. But this question not related to peritonitis. This question talking about the assessment require immediate intervention. First of all, blood pressure 168 over 80, 88. It is little bit higher, but not a life-threatening condition. Maybe the blood pressure is high because patient was hypertensive or CKD patient, the chance of high blood pressure. The pulse is 72 per minute, right? Is almost normal. The client experiencing intermittent nausea. There's some factor to develop the nausea, even the side effect of peritoneal dialysis or other medication. Definitely nausea is not a life-threatening condition. And crackles present in the side, left and right lungs. So I said the peritoneal dialysis, the most risks peritonitis And peritonitis patient present cloudy dialysate or leakage or bloody dialysate or sign of infection. Out of 4, we do not see anything for peritonitis. Number 4, presence of one pitting edema at the ankle and feet. Edema is important, but it is 1+, means mild. This edema may be because of medication like amlodipine or kidney problem or other problem, but 1+. Out of 4, the added sound like crackles in the base of lung, it indicate patient fluid overload or respiratory complication, right? So out of 4, definitely respiratory complication is the most priorities we could inform the healthcare provider. What else? They said during peritoneal dialysis, dialysate is infused into the abdominal cavity and tubing is then clamped to allow the fluid to dwell of a specific period. So in peritoneal dialysis, dialysis is go through the peritoneal cavities. The sterile fluid is go in after few time because of gravity, the waste product is came out. And during the installation and dwell portion of the cycle, the client are monitored closely for any kind of complication like peritonitis or respiratory distress. Respiratory distress means if you see difficulty of breathing or rapid respiration or crackles, that can result of installation of dialysate is too rapidly. Dialysate means fluid, sterile fluid or normal saline. Overfilled the abdomen and fluid entered to the thoracic cavity in the lungs and patient complain of complication like respiratory distress. What are the objectives? Here, the client receiving peritoneal dialysis should be monitored carefully for signs and symptoms of respiratory compromise, including difficulty of breathing or shortness of breathing, rapid respiration, or any added sound like crackles. So the question number 3, the nurse is admitting a client who has a quadriplegia, right? Quadriplegia means paralysis of all 4 limbs, upper extremity and lower extremity, or it is called tetraplegia. So how you different between paraplegia and quadriplegia? Quadriplegia, upper extremity, both hand, and lower extremity means both legs paralysis. Paraplegia means only the lower extremity, means both legs paralysis. Hemiplegia means any half of the body paralysis, maybe left hand and left leg or right hand, right leg. It is paraplegia, hemiplegia. But I said quadriplegia, patient paralysis in the all 4 limbs or upper and lower both extremity, or it is called tetraplegia. So your patient is a tetraplegia or quadriplegia. Of these 4 different types of call device. So when patient at the room, we give them call light, When they need us, they push on the button. The red light is blink on the over the door, and you should go. So your patient is quadriplegia. Now, which device is good for them? So number one, it is a small pointed, but the patient finger is not working well. How they bring, how they push. Number two is a remote look like same. Number four is also same, but number three is bigger. Maybe they can use their tongue, leaves, head, because head area is not part of the quadriplegia. It is not extremities. So answer three they prefer. So their explanation is here. The client who is quadriplegic will have limited to no functional mobility in his arms and hands and will therefore be unable to use any device that require the pushing a small button. So device number one, number two, and number four need a small area to push, but their hand or feet both are paralysis. But instead, the nurse should provide a call device that is require application of a small amount of pressure over a large area, as the client will probably need to use the head to activate the signal. Other old device that this client would probably be able to activate include those activity by blowing through a tube or moving the eyes. A key elements of promoting safety when the client is in acute care setting is to ensure that there is a method of signaling the staffs for assistance at all the times. The nurse should ensure that the type of call device fit the client capabilities, that the client is able to use it, and that it is always placed where the client can activate it before the nurse leave the room. The nurse receiving four client. Which client should the nurse go first to check? The four option. So I always said this type of clinical question you try to answer by A, B, C, D law. First of airway, breathing, circulation, any other disabilities. If ABC law does not follow, then try to follow the Maslow's law. Means what requirements is most important, right? So four patient. That patient number one, the client end stage renal disease receiving hemodialysis. So right now, patient taking hemodialysis. During the hemodialysis, the patient report fever and chill and nausea. Maybe the patient develop infection. If patient develop the infection, you can give an order to collect the blood and check for the blood culture and start the antibiotic. It take time. It is not a life-saving condition. It is not affecting the airway. A for airway, B for breathing. It does not. The client taking ibuprofen for ankylosing spondylitis. Ankylosing spondylitis is an autoimmune disease, very bad disease. Patient complain of pain and you can tell them to take non-steroidal anti-inflammatory medication. Because of take pain medication for a long time, patient chance to develop ulcer, and because of ulcer, maybe causes bleeding with the stool, so black color stool. Definitely, we could evaluate it, exclude it, why it is black color, maybe blood is mixed. Although the ankylosing spondylitis is autoimmune disease, but patient will not die within a second. Patient number 3, the client with altered mental status who does not follow the commands and started vomiting. One is mental status altered, does not follow your commands, and also vomiting. So vomiting, during the vomiting, if does not maintain your comments, does not maintain the posture, and patient is a mental status altered, the chance to vomiters go inside the respiratory system and patient chance to develop stoppage or obstruction, aspiration of respiratory system, blockage and die. So little bit your help, you can save the life. Directly or indirectly, this patient is related to the airway, related to the breathing, A, B, C, D law. Number 4, the client with acute diverticulitis receiving antibiotics who report increasing abdominal pain. So diverticulitis means inflammation of diverticula in the GIT. They need the treatment. It is not a life-threatening condition. The most priority is a respiratory problem, number 3. So their explanation, the client with altered mental status are not following the commands, are or is at the risk for aspiration and airway compromise for vomiting. This client should be assessed first. The client needs to be placed lateral positioning with head is elevated and may need emergent intubation. So you will be prepared with all of your equipment for intubation, right? And what are the educational objectives here? The client with altered mental status and not following the comments are the risks for aspiration and airway compromise from vomitings. So question number 5, when caring for an adult client who is in the soft wrist restraint, what are the appropriate nursing action to prevent interference with the medical treatment? So you already put the restraint. What are the your responsibility to prevent to prevent for any kind of damage? So if anything bad happen, then medical treatment will be interrupted. So what are the best option for your patient who under the restraint, right? So it is, I want to share some most important information about the restraint, what NCLEX board asks like to ask the student. So keep in mind, if your patient has a seizure, during the seizure means involuntary convulsion, movement of the limbs. We do not restrain the time of seizure. This is very important. Okay. If there are two types of restraint, one is physical, other is the chemical. Physical restraint means like you put the belt or tied up with a side rail. Chemical restraint means so many medication, right? So during the restraint, we must follow some rules and regulation. So we must need doctor prescription or order to put the restraint to a patient, and always order need renew every 24 hours by physician. Only RN can put the restraint with doctor order. When the doctor write a restraint order, or when the RN can read the restraint order, always we have to keep in mind some point what they are, like what type of restraint I have to put to my patient. Is it physical? Is it chemical? What type? That what are the reason I should put the restraint to my patient? What are the location? Is it hand? Is it on legs or wrist? Location, and also duration. How long, right? So I said always, if like at the midnight, you need to put the restraint for patient safety, for your safety. In that case, we can put the restraint and take the phone order, but need 2 RN always there to read the prescription or take the order or put the restraint, right? So here the 4 option: assess the burden scale every 2 hours, assess the peripheral circulation and renovascular status. So every 30 minutes, we should check the blood supply, nerve supply, and local uh, skin, right? Any redness or any inflammatory change. So peripheral circulation means check the pulse, sensation, neurovascular, right? If it is okay, all should be fine. Offer liquid nutrition and toileting. It is important, but priority is checking the blood supply and neurovascular status. Release the restraint, perform the range. We could do this, but most priority to check it. So what is their explanation and education objectives? Wrist restraint can cause the skin breakdown and circulatory or neurovascular system affected. According to the guideline, the nurse assesses the skin integrity and neurovascular status, means pulse, color change, skin temperature, sensation, and movement. If all is okay, neurovascular status is okay, and medical treatment will not be interrupted. So what is the objectives? The client in medical surgical restraint used to prevent interference with medical treatment are monitor and assess according to the federal, state, and regulatory agency guideline. Guidelines include the client observation and assessment of skin integrity and neovascular status every hour, restraint release, and also the movement or exercise every 2 hours, offering fluid, nutrition, toileting every 2 hours. The most priority, check the neurovascular status.